Welcome. This is the second part of our parent suicide prevention online training. So, when we talk about, all of the causes and the risks associated with suicide, we also want to give you the hopeful news that there are a lot of protective factors for our students. So, the first is mental health care. Like I mentioned earlier, 90% of students that attempt suicide have a treatable mental health disorder. So, if we can get them connected to mental health care that really works for them, this can be a huge help. Family engagement is huge as well, which is why we've created this training. We want to equip you guys to know the red flags and be able to intervene. Peer support is huge. Connectedness to school and community. This is a big reason why we have positive behavioral interventions and supports, PBIS, at all of our schools across the district. And the whole purpose of PBIS is to engage students in their school sites and help them to understand the positive environment that can come from being in their school community. Problem solving skills. So we have talked to teachers a lot about if a student can learn how to solve a really difficult math problem in class, they can take those skills home and apply those same skills. So it may not be that they're solving a math problem, but they are having to work through something that is a challenge for them. And they've already seen that they can do that in a school setting. And so they can take that home and do it at home. Self-esteem, cultural and religious beliefs. We know that when students have something bigger than themselves that they believe in, this can give them purpose. Self-care. As parents, you guys are adults in their lives and they are watching every move. And so if you can model healthy self-care for yourself, so, getting daily exercise, sleeping enough, taking care of yourself as far as going to counseling, that's going to encourage them to take care of themselves. Restricted access to lethal means, which we talked about, and we'll talk more specifically about what that looks like in a little bit. And then exploring purpose in life. This is a huge protective factor for students. If they can see beyond these middle school, high school years that are so challenging and see a bigger purpose in life, this can be a huge protective factor for them. This is a video that we have linked into the HyperDoc where you found the rest of this series, and I really encourage you to watch it. It's a really great video that teens put together, and it's them sharing about what it can look like for a student to be struggling with suicide, and then helpful things that parents can do and say, and things that are not helpful that parents often do and say. So I really encourage you to go and watch that after you finish this video. There's definitely some preventative measures that you can take as a parent. So obviously creating a safe and open environment in your home, letting your student know that you are someone that they can approach for support, removing lethal means from your home. So if you have guns, making sure that they are out of the home or locked up where a student would not be able to access them, making sure that you do not have any extra medication laying around the house. And if you do have medication that you need to be taking, that it is locked up and not accessible to the student, things like that. Repeatedly demonstrating love in both word and action, regardless of your student's behavior. Obviously, this is a very challenging thing if your student is acting out a lot, but repeatedly demonstrating consistent love and affection for them is really important. Being aware of your child's activity online. We see a lot of cyberbullying, and a lot of times parents have no idea it's happening because it's all happening online and they're not aware of what apps their student is even using. We have on our social worker resource webpage, we do have a lot of tools that are related to how you can responsibly, manage your students' online activity and conversations that you can have with them to encourage them to use it in a healthy way. And then lastly, encourage your student to seek mental health treatment. We recommend that you specifically request DBT, which stands for dialectical behavioral therapy. And this is evidence-based as far as being the best treatment modality for when a student is struggling with suicidal thoughts. And most importantly, we encourage you to participate in the therapy with them. Family work is a huge part of therapy. And if parents are not able to engage in the therapy, it really makes it a lot less effective for the students. So if your student is in crisis, these are just a few steps that you can take from your end as a parent. So the first is to keep an eye out for red flags, the ones we previously talked about. and reach out to them. You want to ask them directly if they're considering suicide. So some parents kind of freeze up and are afraid to ask because they're like, I'm not really sure what I would say if they did respond that they're thinking about hurting themselves. So the first thing that we want to remind you is to remain calm. If you remain calm, it's going to be contagious with your student. Just like panic is contagious, calm is contagious. So if you can remain calm, that's going to be really helpful in the situation. Some things you might say are, thank you for trusting me to share. I'm sorry you're feeling so overwhelmed. Sounds like you have a lot going on. Let's keep you safe. These are some examples of things you could say. If you reach out to your student and they just totally shut down or refuse to share, we recommend that you just share the things that have been concerning you. So, hey, Johnny, I noticed that you used to love going to basketball practice and hanging out with your friends, and I noticed that you're not going to either of those things anymore, and you're sleeping a lot, and you seem really upset. Let the student know that you and other adults in their life are open to talking anytime, and then give them suicide hotline numbers or call the Pleasanton Police Department depending on the severity of your concern. So these are some hotline help 24/7 supports that are available to our students. So the National Suicide Hotline, they can call at any time and speak to a trained crisis counselor. If they're not comfortable talking on the phone, texting is a lot more comfortable for most of our students. So they can text home to this number and a trained crisis support counselor will respond to them via text. Pleasanton Police is also an option for you. So if you are really concerned about your student, you can call them and ask for a well check and they will come out to the home and assess your student. This is also a number you can call if maybe one of your own students' friends are threatening to hurt themselves or your student is concerned about one of their friends. You can always call Pleasanton PD to have them go check on the student. So once you've asked directly if the student is considering suicide, you really want to listen to whatever they share without trying to immediately help, and you never want to promise confidentiality. A lot of times we want to hold our kids' secrets for them. We want to be that person, but this is a really serious matter and we need to make sure that we're getting them help. You also want to trust your gut. So if you are feeling like, I don't know what's going to happen here, but I just have a bad feeling, better safe than sorry. You are going to want to initiate psychiatric hospitalization. So what that looks like is getting your student like intensive mental health treatment. And there's a few different ways to get your child to that place. So if your student is needing immediate medical attention, you're going to take them to the emergency room. And at the emergency room, a police officer will do an assessment. So your student might need medical attention if they come and confess to you that they already swallowed pills or if they already, used a knife on their body at some point. So that would be a situation where they would need immediate medical attention and you would take them to the emergency room. If your student comes to you and just shares that they are struggling with suicide and they're willing to get help, you would take them to Willow Rock Crisis Stabilization Center. This is in San Leandro, and this is the address for it, 2050 Fairmont Drive, and they will assess your student for you there. And if you are really concerned about your student and they share that they are thinking about hurting themselves, but they refuse to go get help, you can call Pleasanton Police Department and request a well check. And if the police come and they are concerned about your student and assess that they are in need of psychiatric care, they would put a 5150 or 5585 hold on your student, which would legally put them under police care. And so the student would need to go and get that help. And I'll explain a little bit more about what that looks like in a couple slides. So what happens if a student is deemed at risk during the school day? The first step is that a counselor is going to talk to the student and decide if the student needs to be formally evaluated. In Pleasanton Unified, our counselors do not do the formal evaluation. We call in a trained police officer that's going to do a formal evaluation with the student. So we do have school resource officers that are on campus, but there's a couple days a week that they're not on campus, or maybe they're at a different school site because there's a different emergency going on. But some trained police officer from Pleasanton PD will come and do a formal evaluation with the student. And if they feel that the student is at imminent risk of hurting themselves or others, they can be placed on a 5150 or 5585, and they would be transported via ambulance. via ambulance, and parents would be contacted so that you can work together to provide as much support as possible to your student. So when we talk about a 5150 or a 5585, this is what can be up to a 72-hour hold. And it means that when someone is in serious need of mental health treatment, they can be transported to a designated psychiatric inpatient facility for evaluation and treatment for up to 72 hours against their will. So they are in police custody once a 5150 or 5585 hold is placed on them. And this is simply for the student's best interest and safety. When students get to the hospital, they're going to receive treatment, and upon leaving, the student is going to be given a discharge plan that outlines recommendations for how to support them in their home environment. So ideally, best practice is that the student stays at the hospital until they are deemed safe enough to return home. And then when they get back to school, we really encourage you to reach out to the counselor and have a reentry meeting with the counselor and talk about what can we do to all work together to support the student coming back to school. We will let teachers know if you are okay with us letting them know that the student is returning from hospitalization. We only want to provide them with information on a need-to-know basis because we really want to respect confidentiality of the student and parents. So if your student is hospitalized after school hours, so maybe on the weekend or in the evening, we encourage you to email your counselor and let them know that your student was hospitalized. This is really helpful information for us to have in supporting your student. But please assume when you send the email that they will not see this email until they've returned to their office for normal working hours. Once this counselor returns, they will follow up with you about next steps. Lastly, we really just want to talk about the fact that in order to take care of your student, you really need to take care of yourself first. So it's like the whole idea of the oxygen mask on the plane. You first need to secure yours before you secure the person next to you. So some tips to care for yourself is, if your student is struggling with suicide or if you have a serious conversation with them, acknowledge that this was an intense event and that it's a lot to handle, and talk to someone about what it was like for you. District social workers are here to help you secure mental health services if needed. So although, yes, we do want to help students get connected to counseling services, we also recognize that students are going to do better if their parents are seeking the support they need. So we want to help you get the support you need with counseling as well. We have a link to mental health resources in the area in this HyperDoc under additional resources. And then lastly, allow this to be a group effort by engaging your student's counselor and the support team at their school. Don't take this on alone. We want to support you as a school district and as a school site. So please let us know how we can be working with you to best support your student. We hope this was informative for you and that you take a look at the other videos and resources we have linked into this HyperDoc.